Hi everybody, this is Dr. Eliana, Director of EMA Care. It's May 26, 2020, and today we're going to talk about coronavirus versus the flu, how they compare. There's a new study that came out, some new media coverage that came out that was not particularly accurate, and how this can impact us going into the second wave in the fall, which is what the experts are anticipating. So basically, first I'm going to talk about a comparison of these two illnesses so that you can understand what the differences are, and then we're going to talk about the impact. So first of all, when we talk about the flu, obviously, we know millions of people get the flu every year. However, most people have mild symptoms. 1% of people in the U.S. are sick enough with the flu that they need to be hospitalized. In the United States, it's estimated that about 12% of people with coronavirus are hospitalized. So that number jumps up quite a lot more. So as far as utilizing resources, you can't compare 1% with 12%. It's quite a big difference. The death rate of the flu in the United States is 0.1%, or 1 person in 1,000 people who actually have the flu. The death rate from coronavirus ranges from 0.2% in, let's say, babies and very young people in developed countries, all the way up to about 16%, again, depending on age, country, and other factors as well. Even when we consider the undocumented cases, the silent carriers, as I like to call it, we estimate that the death rate from coronavirus is at least 10 times that of the flu. So even conservatively, I would say 6 to 10 times would be the most conservative estimate. So, and a lot of people believe it's actually higher. We don't know until we are able to look back at this disease with a lot more knowledge than we have now. But hopefully in the next few months, there'll be more information about this. But we do know that even in considering all of these different studies that have come out, we're talking about a much higher death rate. So the flu and coronavirus are both spread by respiratory droplets or aerosols, meaning anything that comes out of your mouth when you speak, when you cough, when you sneeze, when you sing, when you talk, even when you breathe. And they're contagious through the same mechanisms. However, the coronavirus is much more contagious than the flu. How do we know this? So, for example, if you've heard of the R0, which is the reproductive rate of a disease. So, for example, the measles, the reproductive rate of measles is, for every 1 person who gets the measles, an average of 13 to 16 people will get it from them. So in an unvaccinated population. So the R0 there would be 13 to 16. The R0 rate for the flu is 1.3, which means that for every 1 person who has the flu, about 1.3 people will get the flu from that person. Now, anything over a 1 is considered potential for an epidemic, because that means it's spreading more. Okay, so if each 1 person who gets the flu only gave it to 1 person, it wouldn't really spread that much. The R0 rate, the reproductive rate of coronavirus, is estimated to be between 2 and 6, depending on several factors, but that's what we're seeing in different studies that have been done internationally. So that's a really big deal, because when you're talking about a disease spreading more easily, and of course we're talking about an incubation period that's quite long. The flu has an incubation period of 1 day. That means if I catch the flu from my neighbor, by the next day I am going to feel terrible. I'm going to feel sick. A lot of people describe the symptoms as like, I got hit by a truck. I was fine and all of a sudden it got to me and I feel terrible. So I only had about 1 day to spread this disease to people before I was basically in bed for 2 weeks with the flu. Remember, the flu lasted an average of, let's say, 10 to 14 days. So you got 1 day to spread it. With coronavirus, you got 14 days to spread it. 14 days of an incubation period means I can spread it to many more people before I even recognize that I'm sick. So that is obviously a problem. And the symptoms for coronavirus start in a much more subtle way. So it's much more gradual. I might feel a little shortness of breath. I don't really pay attention. I really feel okay. And with a lot of people who had very severe coronavirus, they actually had dramatically low oxygenation numbers, and their body compensated because they had been sick for so long, and they didn't even realize it, that their body compensated as if they were climbing Mount Everest, where they were adapting to lower oxygen levels. So, you know, in considering that, you need to realize that that has a tremendous impact on differentiating between these illnesses. So the symptoms of the two illnesses have a lot of overlapping qualities. So the flu typically has a fever, cough, sore throat, muscle aches, nasal symptoms, fatigue, gastrointestinal symptoms. And again, the symptoms start very quickly. With coronavirus, again, you could get any of those. So it's fever, cough, shortness of breath, sometimes muscle aches, sometimes chills and shivers, nasal congestion, fatigue. Sometimes people are getting gastrointestinal symptoms. A loss of taste or smell has been documented, obviously. So the symptoms really do overlap very quickly. Another difference is that the flu has a particular effect on children and pregnant women, while coronavirus impacts them a lot less. So until now, we've known that the coronavirus affects children. Many of them aren't symptomatic or mildly symptomatic. The death rate in children is very low. The death rate in pregnant women is very low. They're not considered high risk. And in the flu, they are considered high risk. However, now we're discovering that children who had COVID may develop Kawasaki disease. This has been reported in over 100 children in New York State. And that itself is a deadly illness. So it's a secondary condition that seems to be developing in children who've already had coronavirus. So we don't really understand this yet. It's still early. It's only been reported in the last few weeks, but we're watching. So a study was published. So first of all, there was an interview in an Israeli newspaper. Former Director General of the Ministry of Health said that everyone's making a big fuss about coronavirus. It's just like the flu. We have to calm down. So I think we just reviewed that, in fact, it's not like the flu. And actually, a study was published in the Journal of the American Medical Association a couple weeks ago by Harvard University and Emory University that reviewed the weekly statistics of flu at the height of the flu season versus coronavirus at the height of the coronavirus. And you need to realize the flu season in America is usually October to April. So the whole beginning of the flu season and the peak of the flu season happened before coronavirus even hit in this wave for the United States. So what they looked at is how this peak of the flu compared to this peak of the coronavirus, even though they didn't quite line up this year. And basically, what they found is that during the flu season in the United States, there were 62,000 deaths altogether. While we know that we've had coronavirus in the United States for about 2.5 months or so, and there have been over 100,000 deaths reported as of today, and counting, of course. We're still very much, we're having new cases and new deaths. So in the deadliest weeks of coronavirus versus the deadliest weeks of the flu, there were 10 to 40 times the number of deaths for coronavirus. That is a very significant number. Remember that we started the coronavirus season, season, I don't even know if it's going to be a seasonal thing. We hope it won't be. But we started very, very late. We started in the spring, really. So we missed the whole winter month, the impact of how that would look. And we don't know what it's going to look like in the next wave. What does this all mean going into next year? I mean, everyone's asking this. So the concern is, number one, everybody who gets the flu is going to need to be tested for coronavirus because the symptoms are the same. We just don't know what they have. And the treatment is very different. So, and the contagious level, very different. Like I said, it's a whole different situation. So when we're talking about an active flu season that's going to hit September, October time, we know that we are going to end up with a lot of people getting symptoms, and we need to be able to distinguish. So we think that testing levels had to be high now. Testing levels are going to have to be much higher going into the flu season because we need to be able to distinguish between these two illnesses. And that's absolutely critical. So one thing that's going on right now, and the CDC already started talking about this, is that flu shots are really going to be important this year. Some people say, well, I don't need one, I don't get one, I never got one, I'm not high risk for the flu, what's the difference? I don't like vaccines, I don't like needles. There's a million reasons why you shouldn't have a vaccine, and there's a million reasons why you need to have a vaccine this year, okay? And one of them is, if we have everybody with the flu and everybody with coronavirus all running to the doctor, running to get tested, going to the hospital because they think they're sicker than, we're going to end up completely flooding the healthcare system. Think about now how Israel, for example, had these drive-through testing sites, and we didn't really have more than about 13,000 a day. We're going to need upward of 30,000 a day to keep up with people who have these symptoms going into the flu season. So having these quick tests that are reliable, we saw that there's a new test that was developed at Ben Gurion University, which is an inhaler test. It takes a minute to have a diagnosis. The diagnosis appears to be approximately as accurate as the regular PCR testing that's being done. If they're able to mass produce these tests, then that will really help in getting people the answers that they need. Right now, people get a test, and the typical test takes a couple days at least to get results. Now, if you flood the system with tests, then what happens is that people don't get results for a week, or people can't get their test for a week. And then you have no idea what to do. Everybody who has the flu, if they're also going into quarantine, then you have a huge, ridiculous number of people in quarantine for having the flu. Now, having a stay-at-home order for people who are sick makes complete sense. I've always been in favor of that. But now we're talking about actual quarantine, and we know that's a much different thing than just staying at home. So going into next year, knowing that we have a huge crossover between these illnesses, it is absolutely critical that we vaccinate, that we increase our capability of testing en masse, and that we are vigilant in being able to follow up with that testing and make sure that people are, in fact, monitored correctly, that they're not given restrictions that they don't need until they need them. Again, or else you're going to end up with a quarter of the healthcare workers on quarantine because they have the flu, because they have a cold, because of all these different things that happen. We didn't have to go through that this year, but we will have to go through it in the next wave. So we need to be prepared. And, we've been vaccinating students here in Israel for many years. I highly recommend that everyone plan to get vaccinated. Whether they're coming to Israel or whether they're in whatever country they're in. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone stays healthy.